Hey everybody, this is Dr. Ciparroni, your Solana Beach chiropractor, and today we're going to be taking a look at sciatica. So what is sciatica? Sciatica is that pain, numbness, burning, or tingling feeling that you have that can go from as high as the low back and all the way down even into the foot. Oftentimes patients will come in and they say either my doctor diagnosed me with sciatica or Dr. Google diagnosed me with sciatica, and my next question is, what's the cause? Because sciatica really is just a symptom that you have nerve compression either in the low back, the sciatic nerve, or possibly even lower down the chain in the leg. So let's take a look at some of the common causes for sciatica and why you might be experiencing that pain. So the most common cause for sciatica is a lumbar disc herniation, so a disc bulge or herniation that occurs in the low back. That can put pressure on the nerve roots that form the sciatic nerve and cause that pain, numbness, burning, or tingling into the leg. Another common cause we see for sciatica is stenosis. So stenosis is when you have a narrowing of where the nerve root exits the spine, either due to bony or possibly soft tissue like part of a disc has made that canal smaller, and now the nerve root that goes out of there is being encroached upon. And nerve roots are very sensitive to pressure, so you can get that burning, numbness, tingling, pain sensation down the leg. Another common cause we see here in clinic is what's called Piriformis Syndrome. So the piriformis muscle runs from the sacrum all the way to the leg, and the sciatic nerve in most people will actually go behind that muscle. And when that muscle gets tight or it gets very toned, what happens is it can put pressure on that nerve and give you that feeling of sciatica, those sciatic symptoms down the leg. In some people, that sciatic nerve actually pierces the piriformis, so those people are actually more predisposed to developing sciatica. One of the other common causes we see is the SI joint. So the SI joint is right where the pelvic bones meet the sacrum. That joint can actually become irritated, and if it gets very irritated, it can actually leak fluid out of the joint, putting pressure on those nerves, putting insult to those nerves, causing that radiation of symptoms down the legs. That's a different type of problem that we actually don't treat here in clinic, but we do diagnose it, and we need to know what to do with that once it's diagnosed so we can get you to the correct provider. And then finally, another common reason we see sciatica is actually a peripheral nerve entrapment, or an entrapment where the nerve isn't moving well. That's in the lower leg, giving off those symptoms of burning, numbness, tingling, pain that goes into the foot and into the lower leg. So a lot of times that can cause what are kind of like sciatica symptoms, but it's not a true sciatica. So that's why it's always important to diagnose the cause of your sciatica, because again, sciatica itself is just a symptom. It's just that burning, pain, numbness, tingling that goes down the leg and sometimes into the foot, but it's not really a cause. So we want to know what the cause of that sciatica is. So here in clinic, we have a number of tests that we use to diagnose where your symptoms are coming from. Once we do some of these tests, we can figure out exactly what tissues we need to treat, what exercises we need to give you to perform, what you can do at home to help yourself, and most importantly, what movements are causing your pain, and how can we get you to avoid those throughout your day so that you don't keep stoking the fire and causing that nerve pain down the leg. So when a patient comes in with sciatica, the first thing we want to do is figure out the cause. What's causing that burning, numbness, tingling, and pain down the leg? The next thing we're going to do is we're going to figure out exactly what they're doing throughout their daily routine that's making that pain worse, and how can we figure out ways for them to avoid that. Next, we'll figure out exercises and different things they can do at home to help with their symptoms. And finally, we're going to apply active release techniques to different areas of the body to help free up the nerve entrapments and to help get better motion through the spine. After doing all of that, patients generally report relief from their symptoms in just 1 to 2 visits. And after about a 6 to 10 visit treatment plan, we have them feeling better and ready to go, and we start to strengthen the area and figure out ways they can prevent the symptoms from reoccurring in the future. So if you are having sciatica, make sure you are getting that diagnosed and make sure you know the root cause of your pain.